Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another case study, and the subject is acute glomerulonephritis. I really wanted to keep it from you because that's one of the questions. However, you need to know the title, the subject matter that we're going to be covering. So it's going to be acute glomerulonephritis. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you have done so already. And be sure to check out my website, nexusnursinginstitute.com. There's so many resources there. You can sign up for private tutoring sessions with me. You can sign up for a consultation session. You can sign up for Next Generation NCLEX Review Part 1, Part 2. If you're currently in a nursing program and you are struggling, you need help now, and you can't get in with me for a private tutoring session, you've got an exam coming up that you absolutely must pass. Check out my audio lessons and see if I have one that matches the next exam that you're going to be taking. Almost daily, guys, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook. Right here on YouTube, my handle is the same everywhere, Nexus Nursing, so be sure to check that out. So guys, let's get started. I'm going to go ahead and move this over. Let's take a look on my left side. Look at this patient profile. Patient's name is Jacob Miller, 10-year-old male. Wait, let me stop. Let me go back. So guys, when you get a case study, and the case study, you get multiple choice questions, select all that apply, drag and drop, highlight, bow tie. I don't care. If you are being bombarded with a lot of information, some of it's going to be fluff. Some of it are going to be distractors. You have to be able to filter through it. So I've said this on many of my other videos, but I'm going to repeat it again because I know I have a lot of new people that watch my video and this is their first time. So here's how you do it. You read through the case study, you read through that information the first time, just read through it. And then you read it again a second time, but the second time you underline, highlight, put a star next to whatever it is you need to do, any abnormalities, anything that's abnormal, anything that is out of the normal range, you're going to pay special attention to it because together that's going to paint a clinical picture for you. So you're going to read the information first, then go back over a second time. And I'm going to do it with you so you can see what I mean. So let's go. Jacob Miller, 10 years old male, recent recovery from strep throat infection 2 weeks ago, no prior history of renal issues. Chief complaint, swelling in the face, dark cola-colored urine, and reduced urine output for the past 2 days. Clinical presentation. Upon admission to the emergency department, the nurse conducts a thorough assessment. The following findings are noted. Vital signs, temp 99.8, heart rate 102, respirations 22, blood pressure 142/90. Physical exam. General appearance, facial puffiness, especially around the eyes. This is known as periorbital edema. Skin is pale with mild pitting edema in both lower extremities. Urinary output decreased. Output, dark cola-colored urine. Neurological status, alert and oriented, but reports fatigue. Lab results. BUN 38, creatinine 1.8. Your analysis is showing protein 1, 2, 3, 4 plus. RBCs positive, many CAS present. ASO titer positive, GFR 45. Okay? We read this information. Now we're going to go over it a second time. And this time, we're going to pull out anything that is abnormal. Jacob Miller, 10-year-old male, medical history, recovery from strep throat infection 2 weeks ago. No prior history of renal issue. That medical history of what? Recent. Okay, so this isn't something that happened years and years and years ago. This is something that just happened. That's out of the ordinary because it may have something to do with what's going on with our patient right now. Let me go ahead and highlight this right now. Recent recovery from strep throat. Here's my little highlight thing. Okay. Chief complaint. Let me tell you something. Anything that comes after either chief complaint or patient presents with or client presents with, whatever is actively going on with that patient right now, that's what's wrong. That's our problem. So we're always going to pay special attention to it. So let me go ahead and highlight all of this. Swelling in the face, bad. Dark cola-colored urine, bad. Reduced urine output for 2 days. All of that is bad. Upon admission to the emergency department, the nurse conducts a thorough assessment. Now, vitals, 99.8, heart rate 102. That's abnormal. It's slightly elevated, but guess what? It's still elevated. Respiratory rate 22, blood pressure 144, 142/90. That's also elevated. General appearance, facial puffiness, especially around the eyes. That's not normal. I'm just going to highlight the periorbital edema and the facial puffiness, actually. Oh, guys, be patient with me. I am not technologically savvy. All right, skin, pale, edema both extremities. Urinary output decreased. That's a problem. Urine output should be at least what, 30 mLs per hour. And we're seeing that dark cola-colored urine again, abnormal. Neurological status alert, that's good. Oriented, that's good, but reports fatigue. That but reports fatigue part, that's bad. That's abnormal. So let's go ahead and highlight the fatigue. Let's go to the lab results. BUN, that BUN is too high. That creatinine is too high. Urinalysis, are we ever supposed to see protein in the urine? Absolutely not. Are we supposed to see RBCs in the urine? Absolutely not. And not only are we seeing RBCs in the urine, we're seeing CAS, that's present. ASO titer, positive. That's abnormal, but that falls in line with that patient having that strep 2 weeks ago, right? And last, the GFR, that is lowered, so we know our kidney function isn't working the way it's supposed to. So notice how, before I even get to our bow tie question, before I even get to what they want to know, I'm pulling out everything that can give me a clinical picture of exactly what's going on with this patient, because that'll also give me an idea of what I need to be doing for this patient. Okay? So now that I've done this, guys, I'm looking at this. The first hint was that this patient had a recent strep throat infection. The second hint, they're having swelling, they're having edema. The third hint, cola-colored urine. Ding, 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 ding. Let me tell you something. If you did not get that first hint of the recent strep throat, you couldn't see where they were going. And then you saw that swelling in the face, and you still didn't see where they were going. The minute you saw cola-colored urine, you should have known where they were going with this. What do we suspect is happening? That patient's having acute glomerulonephritis, right? Because when it comes to strep throat infection, there are very few things that's associated with that when the patient's had a recent strep throat infection, right? Acute glomerulonephritis is one of them. Right? But there are a couple other things that it could be. Swelling in the face, yep, other couple things that it could be. But that cola-colored urine, when you see that that is a classic. That cola-colored urine, along with having the edema, those are two classic symptoms of acute glomerulonephritis. That's exactly where your mind should have gone. And everything else is reinforcing it. Reduce urine output for the past 2 days. Heart rate slightly elevated. It's going to be slightly elevated. Why? Because the patient's holding on to all that fluid, and the heart's trying to do what? Compensate, trying to help push all that fluid out. The heart can only do two things. It can either speed up or slow down. So what's the heart going to do when there's so much fluid that's trying to get rid of? It's going to speed up. It's trying to compensate. Respiratory rate 22, blood pressure 140/90. Why 140/90? Because of all that fluid. I want you to think about it, guys. What is blood pressure? Blood pressure is the force that's being exerted against the vessel walls, right? So the more fluid you have, it makes sense, the more force you're going to have, the higher your blood pressure is going to be. We keep going. That patient's pale with edema in lower extremities. Again, decreased urine output. Again, dark colored urine. Of course, that patient's going to be fatigued. Now, to top it off, let's look at these lab results. BUN elevate, creatinine elevated. Let me say this to you guys. Very often when the BUN is elevated, is kidney function, but not all the time. BUN can be elevated if there's a metabolic disorder going on, and BUN can be elevated with other disorders. However, the creatinine is specific to kidney function. When you see that creatinine elevated, you should know, you don't know what's going on with the kidney, but you know it's something wrong with the kidney, absolutely, right? Creatinine's elevated. Let's keep going. When we look at the urinalysis, protein, first of all, protein is so large, it should never get past the kidneys. We see protein in the urine, we have a problem. Something's going on with the kidney, right? Not only do we see protein present, look at how many plus signs we see. We see 1, 2, 3, 4. What? Let's keep going. RBCs. RBCs, another one. Huge. Should not be getting, the kidneys are the gatekeepers. Should not be getting past the kidneys. We see RBCs, we know something's wrong. You know, sometimes patient has RBCs in the urine, sometimes it's a UTI, sometimes it's a kidney, but we know something's going on with their urodynamics, all right? RBCs, and not only RBCs present, many casts. When we look at the ASO, that titer is positive. Why is it positive? Because they had a recent streptococcal infection. And then, of course, GFR, the job of the kidneys is to filter. It filters the blood. It takes out all those toxins. It creates the urine, so you get rid of those toxins, right? Look how low the GFR is. GFR is supposed to be more than 90. This patient's is 45. Now, let's take a look over here. I should have highlighted these a different color. But anyway, let's take a look at this bow tie. Are you guys proud of me? I made this little bow tie. I made the boxes, and it took a lot of work. It took me 45 minutes just to make these boxes. I had to go to YouTube to learn how to make the boxes. If you guys have a better idea, please let me know how to make them. But anyway, this is my idea of a bow tie. This is what it looks like. That's the best I can do. Let's look at the middle. It says condition most likely experiencing. Here are the options. We already know what the answer is, but I want you to work through those options. Here are the options. Hypertensive crisis, congestive heart failure, acute glomerulonephritis, Cushing's disease, kidney failure. Yes, that patient's blood pressure is elevated. This is a problem, but we don't see anything that's besides that elevated blood pressure. We don't see anything the patient's in that hypertensive crisis yet, but we see a whole lot of clinical manifestations of acute glomerulonephritis. CHF, yes, they're holding on to fluid. We see that, right? And yes, we see that heart rate's elevated, but it's elevated slightly, not that much. In CHF, especially if it was bad, we would see those respirations go up as well. We, most likely, we'd hear crackles in the lungs. We'd see distended jugular veins. We'd see other symptoms of CHF. We're seeing more symptoms, again, that are more closely associated with acute glomerulonephritis. Cushing's disease is our next option. I don't even see anything about cortisol levels. I don't see anything about buffalo hump. I don't see anything about purple striae. I don't see anything about, decreased level of consciousness or cognition, all those clinical manifestations that we see associated with Cushing's disease, right? And last, kidney failure. Possibly we're seeing a lot of symptoms of kidney failure, absolutely, but that would not explain that cola-colored urine, right? We're looking at acute glomerulonephritis. Now that we understand this is what's going on with our patient. And by the way, when it comes to the bow tie questions, you're always going to start with the middle because everything else is going to depend on the middle, what the patient's going through, what you suspect is happening to your patient. Because if you get that wrong, you're basing everything off of that. You're most likely going to get those wrong too, okay? So now that we understand, yes, this patient has acute glomerulonephritis, let's look at what actions we think we should take. And you have to choose one action in each box. The first box, here are your choices. Encourage ambulation to decrease edema. I didn't have enough room to type in to decrease edema, so I just put encourage ambulation, but I meant to decrease edema. Call the healthcare provider, encourage the patient to turn, cough, deep breathe, and give a diuretic as ordered. What would you choose? Now, with you thinking of your answer that you have in your mind, would you change your answer if I told you that when you're choosing one answer, you have to say to yourself, I can only do one of these things for my patient. Which would it be? Because that's how you're supposed to think. I hope you all chose call the healthcare provider. We have a patient that has come in. They just had a recent strep infection about 2 weeks ago. They're now having swelling in the face, dark cola-colored urine output for the past 2 days. We're seeing all these signs and symptoms. We got to let the healthcare provider know we're going to want orders, guys. Encourage ambulation to decrease edema. That's not priority at this time. Encouraging turn, cough, deep breathe. That's definitely not priority at this time. Give diuretics as ordered. What did it say with as ordered? Yeah, they're holding on to all these fluids as ordered by who? The healthcare provider. We haven't called them yet. Second box. You have to choose one action to take. Give antihypertensives as ordered, monitor the INO, encourage the fluid intake, or begin dialysis as ordered? What do you guys think? And the correct answer, guys, is give antihypertensive as ordered. Think about what's happening, guys. This patient's got acute glomerulonephritis, and usually does happen. It follows a strep infection. And so what happens is a person will have a strep infection, and those immune complex that they build up messes with the kidneys. And then we see all of this happening. Do you know that that cola-colored urine, or sometimes it's described as tea-colored urine, or sometimes the urine is described as pink frothy urine, right? When it's described as tea-colored urine, cola-colored urine, you still should be thinking acute glomerulonephritis. And the reason you're seeing tea or cola-colored urine is because of RBCs, right? If you see pink frothy urine, the pink is because of RBCs, the frothy is because of protein. Proteinuria, RBCs in the urine, acute glomerulonephritis. So anyway, that's the pathophysiology of what's happening. So the patient has had this infection. They build these immune complexes. Immune complexes messes with the kidneys. Remember, the kidneys are responsible for filtration. So the patient is not excreting the fluid like they're supposed to. They're holding on to it. And what happens? The blood pressure goes up, right? This is a 10-year-old child, 142 over 90. 142 over 90 is high for an adult. Remember, for an adult, normal is what? 90 over 60 to 140 over 90, right? So we need to get that blood pressure down. Here are the other choices. Monitor INO, great. Encourage fluid intake, great. Begin dialysis as ordered. Maybe if the patient's kidney function is so bad, they will end up needing dialysis. It's not going to be, for their whole lives. It might be once or even twice, but we're not even there yet. Remember, when you're looking at these options, you have to think to yourself, if I can only do one of these for my patients, it's going to be give the antihypertensives. We're going to get this blood pressure down, right? If that doesn't work, then maybe they might go on to the dialysis if needed. Then, of course, we're going to be monitoring the INO. We're going to be monitoring the fluid intake. But our biggest concern is always going to be what is most harmful to the patient right now at this moment. And right now at this moment is that elevated blood pressure that's going on with them. All right, let's look at the other side, potential complications. You have to choose one potential complication from each box. Let's look at the top box. It says seizures, dehydration, and hyperglycemia. What is a potential complication we're going to be concerned about when it comes to this patient? Seizures, dehydration, hyperglycemia. What do you think? And I hope that you guys all chose seizures. I want you to think about this, guys. Again, look at that blood pressure. We're going to be concerned about hypertensive encephalopathy, and that right there can lead to the patient having seizures. Look at that blood pressure. How's that patient going to be dehydrated? They got all that fluid they're holding on to. Matter of fact, that patient's holding on to so much fluid. Guess what? That patient's going to be on fluid restriction, because they got all this fluid that they're holding on to and it's not going anywhere. And the next option, hyperglycemia. Hyperglycemia. I mean, I could see hyperglycemia if the patient had Cushing's, right? But no, there's nothing here that's going on that we'd be talking about that patient's glucose levels. We're concerned about that patient having seizures from that blood pressure being so high. We need to get that blood pressure low, because one of the complications would be seizures. Now, next, potential complications, you have to choose from three: heart failure, hypokalemia, or hypernatremia. What do you think? And the correct answer, I'm going to give you a few more seconds to think. Heart failure, right? That is a real potential complication, because when you're looking at what's going on with this patient, there are some clinical manifestations that absolutely are associated with heart failure, but more of them really is acute glomerulonephritis. But guess what? This acute glomerulonephritis, if that patient keeps holding on to all that fluid like they are and they're not getting rid of it, it eventually will turn into heart failure, because there's only so much work that the heart can do before it gives up, right? All of that fluid that the heart's holding on to, all of that fluid that the body's holding on to, whose responsibility is it to pump it out of the body? The heart. So a very real potential complication is heart failure that we're going to be concerned about. Let's look at the other two options, hypokalemia. Mm-mm. If anything, we'd be concerned about the opposite. We'd be concerned about hyperkalemia, and we'd be concerned about cardiac dysrhythmias. And the reason that is, think about it, they are not getting rid of their fluids. When you urinate, what comes out of that urine? Potassium. So if you're not urinating, you're not getting rid of your potassium. You're not getting rid of your potassium is building up. You have a very narrow therapeutic range of potassium, 3.5 to 5. That is it. Anything outside of that range, 3.5 to 5, you are at risk for cardiac dysrhythmias, which is deadly, right? So that patient would be at risk for hyperkalemia, not hypo, and hypernatremia. No, that patient would be at risk for hyponatremia. I want you to think about it, guys. They're holding on to all of that fluid. Guess what? The patient has, this is what's known as, what's it called? Dilutional hyponatremia, because all the fluid that they're holding on to basically dilutes it. So it would be hyponatremia. So I can actually do a couple more bow tie questions on this, because when it comes to acute glomerulonephritis, usually that will be a PEDS question, not a question for adult. It'll be presented to you as a PEDS patient, but there are a couple other things you guys absolutely need to know, because you may get questioned on it. So let me know in the comment section if you'd like me to continue these series, because I absolutely will, and cover the other topics that you very well may see on NCLEX when it comes to acute glomerulonephritis. But anyway, guys, the point of this case study really was to teach you how to navigate through the case studies, okay? I want you to read the first, just read it. Just read it so you can get a general understanding the first time. And the second time that you're reading it again, I want you to highlight the most important things to know. And then what that's going to start to paint a picture for you. And you're already going to have an idea of what's going on with your patient, of nursing interventions, maybe even drugs that you expect to be ordered for this type of patient. So let me know in the comment section what you guys would like to see me cover next, or if you guys would like me to continue this as a series until I cover the topics most seen about the subject matter on NCLEX before I move on to the next subject matter. Maybe you guys want to see me cover something differently in a different format, such as a lecture, TikTok, Q&A. That's fine. Just sound off in the comment section. I can't respond to everybody, but I absolutely do read all of your comments. Guys, don't forget, very soon, I have my Nexus Nursing NCLEX test bank coming out very soon. It's going to be going over subject matter that's been seen on NCLEX time and time and time again, things that you absolutely need to know. So watch out for that. It's going to be coming out very soon. I'm very excited about this project. I worked very hard, and I'm so happy that I'm wrapping it up and putting a beautiful bow on it, ready to present to you guys. So it's coming down the pipeline very soon. Guys, thank you so much for watching, and you guys will catch me on the next video.